Well, in a digital world, national security goes beyond protecting physical borders. Experts say the healthcare industry is totally unprepared for cyber attacks. After the hacking of a major hospital group, lawmakers want answers on why this sector of critical infrastructure is so exposed. CBN's Caitlin Burke has the story.
This problem drew attention in February when a cyber attack shut down systems nationwide at Change Healthcare. Now it's a priority after another major attack just weeks ago on healthcare giant Ascension.
We owe it to American patients and to our frontline healthcare providers, from health systems to clinicians and community pharmacies, to ensure that this does not and cannot happen again.
These digital assaults against the healthcare sector have skyrocketed over the last 5 years. The Health and Human Services Department reporting a 256% increase in large information breaches. Still, cybersecurity consultant Carter Groom of First Health Advisory says the industry is playing catch-up just to meet basic standards.
Broadly, the healthcare sector is just not ready, and it's only because we haven't been trained over the past 15 or 20 years like the financial sector has to protect our systems.
Hackers in the Change Healthcare attack, for example, gained access because a server lacked security measures many companies consider mandatory.
Cybercriminals entered a Change Healthcare portal, exfiltrated data, and on February the 21st deployed ransomware. The portal they accessed was not protected by multi-factor authentication.
United Health CEO Andrew Whitty recently told lawmakers his company, which owns Change Healthcare, still doesn't know why those protections were not in place, an admission that didn't sit well.
This is some basic stuff that was missed. So shame on internal audit, external audit, and your systems folks tasked with redundancy. They're not doing their job.
This hack could have been stopped with Cybersecurity 101.
Change Healthcare provides technology used for insurance claims. The attack prevented those from being filed nationwide. While Whitty says the compromised system is now completely rebuilt, he had to pay the hackers a $22 million ransom to get it back online.
That's going to further motivate more attacks because they see that and say, well, these health systems are willing to pay. They need to get back online. They need to get their data. They need to serve their communities and their patients.
Ascension Health System, meanwhile, has not revealed whether a ransom was paid, and fallout from that attack continues, affecting 140 hospitals and dozens of senior living facilities across 19 states. The initial breach forced facilities to divert ambulances, blocked online access to records, and even affected patients getting medication.
They cannot scan the medications. So you can't scan the patient's armband or the barcode on the medication to match to see if that is even a correct order or dose.
Now, weeks later, many hospital workers still report little progress and continuing treatment delays.
It is, in my view, Exhibit A that the country needs tough cybersecurity standards, and they're needed to protect critical infrastructure and patients across the country.
After the high-profile nature of these attacks garnered the attention of the federal government, Health and Human Services is now planning to invest more than $50 million in a cybersecurity line of defense for hospitals to handle these kinds of threats. Caitlin Burke, CBN News, Washington.
Thank you, Caitlin. Gordon, another worrying example of exposure.
Yes, and it just seemed like it was a matter of time before it came to the surface. Obviously hackers want money. And so their first target were our banks and our credit cards, and now they're moving to our most personal information and hospital records. And hospitals, on one hand, want to make everything easily accessible by a patient, and so they're encouraging everyone to get the mobile app and to sign in. But if there isn't two-factor authentication to that process, then you do open up the entire system to hackers, and you just saw it, where a hospital system had to pay $22 million just to get their data back. So you look at this, and yes, there should absolutely be national standards. How do you protect data? And I would add to it, there should be a national standard on individual privacy. For Europe to be ahead of us, for China to be ahead of us on data privacy for our own citizens, it's frankly inexcusable. And what it should point to is, can we please get some legislation through that standardizes this? What do we absolutely expect from our healthcare system, from our banking system, for all the digital records that are kept on you and I by all kinds of companies all around the world? Let's protect ourselves from this kind of menace.